Okay, those of you who are on, if you would, type in the chat box that you can hear me, please. Richard, Dr. Worman, Jay, John, Jack. Please type in. Okay, you can hear me. Good. Okay. That's good. Yeah, for some reason last time the play after didn't catch the video. Hopefully it'll catch it this time. So I'm not quite sure of it. Okay, just a question right off. How many of you have a fairly good way of taking care of Candida right now? So I'm going to show you something that works in a matter of just a couple of weeks. And it's very easy to implement. If you would type over in the chat box, please. Nobody has anything that works too good, huh? Well, that's kind of the normal. Okay, so I'm going to go right to the share screen. And okay, can everybody see that box? Just type in yes if you can. Okay, that's good. Okay, systemic Candida albicans, how to treat it quickly and successfully. First, Candida isn't a yeast, as most suppose. That's what we've heard all the time. It's actually a pseudo yeast. It's a fungus. Therefore, it is not a yeast infection. And that's one of the most, I guess, infuriating things that I've seen ever since I first encountered this, because everybody supposes it's a yeast. When you see that it's a fungus, you get an entirely different idea about how to treat it. Now, Dr. Crook, an MD, sensationalized the condition and made it famous. He said he could bring it mostly under control, but he said he could never get the patient off the drugs. So that would become problematic from the outset. The drugs that he put them on were nystatin and ketoconazole. His main diet regimen points were cut out all carbs from the diet, which basically makes it a keto diet because they feed the Candida, give the patient capric or caprylic acid to strip the shell off the Candida so the body can kill it, then give probiotics to reinstate the normal gut biome. Administer an herbal purge to flush out the acetaldehyde, which is a cousin of formaldehyde, metabolic poison, which is produced by the Candida, which is an opportunistic pathogen to weaken the host. Problems with that procedure. Fungus thrives in an acidic environment, which is why when he withdrew the drugs, Candida immediately recurred. Keto diet causes early death from all causes. How many of you knew that keto diet causes early deaths from all causes when you keep people on it for a long time? Let's see a yes or a no in the chat box. Come on, let's interact a little bit. How many of you knew that an extended keto diet causes early death from all causes? Okay, didn't know that. John said. Jack says no. Okay, most people do not know that. I'll show you a document from that a little bit later here. Probiotics don't survive well in the keto environment, so even though you're putting the keto or the keto diet in, probiotics, it pretty much destroys them. Okay. Acetaldehyde is reabsorbed in the first third of the large intestine. So we got problems with all of these things. Okay. Now, I was on a radio show for a year as a featured guest every weekend for a year on a national radio show. The show was pointed toward fungal conditions. He had me on because of my nutritional background. He had me call him the day prior to tell him what I wanted to talk about, and his show was about 3 hours. I was on the first 5 minutes of the second hour. What he didn't realize is that I listened to the whole show most of the times. People would ask how good I was as a nutritionist. First time he said, a second or third runger out of 10. I thought, okay, what a shaft right there. I decided to start talking about more difficult topics. So I was trying to keep it a little bit on the simplistic side because of the audience. If he was going to start doing that to me, I said, okay, we'll get out there, make it different. So this rose me to a 5th or 6th runger out of 10. Next time someone asked, I got more difficult. This rose me to a 7th or 8th runger. I took each time as a challenge to get into more difficult topics. Now I began getting into topics I knew that he would know nothing about, and I got up to 10th out of 10. As the topics got more and more difficult, as the year went on, he naturally increased my time from 5 to 7, then to 10, then to 15, then to 20, then to 25 minutes, because I made it so interesting that he just gave me more time without even bringing it up. That's basically how you do it, with individuals like that. You make it super interesting to them. After a year, I decided I didn't want to sacrifice my time on a Saturday anymore and gave him notice. On the last show at the end, he said I had never addressed how I took care of Candida, and he asked me to elaborate. And I said I actually act on Dr. Crook's information, but approach it in a much different manner. And he said, really, just how do you approach it? And I said, Candida is actually a pseudo yeast, a fungus, right? He said, right. And I knew that he didn't even know that. Okay, I knew that from the outset. Because I haven't run across anybody who actually knows that when I posed the question to him. Funguses thrive in an acidic environment, right? He said, right. And I knew he did not know that either. Dr. Crook states that he can help most but can never get them off the drugs, right? Right. I knew that he knew that one. Putting them on mostly animal protein puts them in an acidic ketotic state, right? Right. And I knew that he would know that. Therefore, I put them on a diet high in fresh fruits and vegetables, take them off foods high in acids, which alkalizes the system, makes it unfavorable for the fungus to thrive. And he said, okay. I said, I still use the capric or caprylic acid to strip the shell off the organism. I still give them probiotics to reinstate the normal biome. He said, okay. However, I found that the herbal purgatives that stimulate the body to dump the acetaldehyde don't work well because the body reabsorbs it in the first third of the large intestine. Now, you remember this out of your biochemistry, right? So, minerals and et cetera, are reabsorbed in that first third of the large intestine. Well, so is that poison, the acetaldehyde, because it is liquid. He said, okay, so what do you do for it then? Well, I figured out that using the universal absorbent used to help people absorb poisons they've ingested will also absorb and carry the acetaldehyde out of the body, so it won't be absorbed. And you know what that is, right? And he said activated carbon. And I said, right. Doing it this way, I can usually knock out the organism, get people off drugs in about 2 to 3 weeks. He said, wow. And he said, I never really considered all that. Well, it's because he didn't know most of it. And, it's just too simplistic. See, this way, you don't even need the drugs. And he was in trouble there because he worked in a medical office, and that's the only way that they would go about it. They needed people to push the drugs on. And you hate to put it that way. So, basically, because of my demeanor on the show and never attempting to one-up the host, just giving an educational experience for both him and the audience, I got a lot of patients calling me as a chiropractor, as a nutritionist, and from people the host had treated and not helped to get out of Candida. And that was a substantial amount of people. Probably off of each show that I did, and I did this for 52 weekends in a year. And remember, I started out, as a 5, and I got up to, a 2 or 3, second or third runger, starting out at 5 minutes a show, got up to a 10th out of 10 ringer, a runger, out of 10, and worked my way up to 20 or 25 minutes just by making it just super, super interesting. So you got to do stuff like that. Now I'm going to see if I can bring something up here in just bear with me a moment. I'm going to see if I can show you what I was talking about on the ketotic diet. I have to look that up just a bit. Now, type in there while I'm looking this up. Does anybody have any questions so far? Does anybody have any questions so far? Okay, now I'm going to take this particular document down so we can do that. Okay, what test to use to determine Candida? Basically, somebody will come in with that diagnosis, or you will have somebody just spit in a glass of water and it will string down through the water. Okay. Hi, Alan. For some reason I cannot hear, but for your information, the liver enzyme that reduces acetaldehyde is a molybdenum-based enzyme. Okay, well that's good, Alf. This is Alf Garbett. He's one of my mentors. I admire him very greatly. He moved from California to Florida, and thank you for that. I appreciate that, Dr. Garbett. Okay, so now let's take a look at this here. And I don't really need to reduce the acetaldehyde. I just want to get it out of the system. And basically it's my proposition that when you do this right, the body's going to force the acetaldehyde out of the system without doing anything real specific. Basically, by getting people off of the acid diet, the body is going to start flushing out the acids and the acetaldehyde without having to force anything on it. And I used to be up there. I used to do a lot of herbal flushes. And then I started wondering, well, is it really good that I'm trying to force the body to do something? Or is it going to be better for me to basically put the body in a position where it's going to detoxify itself without forcing anything? Because I would put people on these herbal flushes and they would get deathly sick, okay? Now, one of the things I found out when I would switch their diet around and put them on an alkaline diet, then the body would just start automatically detoxifying. And from that point, I hardly ever force any detoxification on anybody. And the fact is, when you switch the diet around properly, then they're going to detoxify and build up at the same time, which is what the body's supposed to do. Okay. Can everybody understand that? If you do type that in there, that you understand that the body normally should detoxify and build up at the same time. If you would type that in the chat box. John says yes. Come on, let's get a little participation in here. Okay, now, how many of you have found that when you try to force the body to do anything, then a lot of times it ends up not being too good? Let's see a yes or a no on that. Yes. Okay, that's good. So let's make things real simple. When I give lectures, when I put my films out, which I have 3 out of 4 of my classes on film, and hopefully when I do this every Thursday, when I do mentoring for people, I look at myself as a shortcut. I've taken $1.5 million worth of seminars. I've treated people from all 50 states and 97 countries, okay? And one of the things I tell people, I average 640 new patient calls every month from 911. A lot of people's practices went down after 911, 30 to 50% or more. Mine went up 1,700%. I started getting an average of 640 new patient calls every single month and maintained that for years. And, I liked that because I could pick and choose what cases I wanted. If I thought it was a simple chiropractic case, I'd just tell them to go to another chiropractor because I wanted the challenging cases, okay? So, when I took care of, for example, football teams, I would tell people, you really haven't lived until you've taken care of a football team, because you have to treat all 72 or 73 players in the hour before the game, treat them all again at halftime, then treat them all again immediately after the game. So basically, just within a period of just a couple hours, and very quickly, you have basically less than a minute or a half minute to treat each of those players, is what it gets to. So you have to learn to think very quickly and get the job done, just like that, okay? So I look at myself as being a shortcut for everybody. And I want you to really realize this. All this education that I have and all this, I want to parlay to you to make it easy for you and easily understandable for you, so that when something comes up, you think, well, this is what I do first, this is what I do second, this is what I do third, etc., okay? And so a patient presents you with symptoms, and you ask a couple of deft questions and you immediately move into the treatment. You do maybe a minor type of exam, and et cetera, and you go right to what to do, and you get jaw-dropping results very, very quickly. That's what I want for you. That's what these are about. So to get this across in a simplistic manner, the host would give his opinion on what I said about a topic, and rather than slamming him, I would say something like, that's a really good, or that's a great thought. In addition, you might want to consider that. So basically, whenever presented with anybody, I don't care if it's with an MD, another chiropractor, an instructor, it doesn't matter. You may know in your heart that you have a better answer than them, but first you want to compliment them. And I'm talking about patients too. Okay, nobody likes to be wrong, but nobody really minds if another alternative is just given to them. So first compliment them, and then give them your idea so that they can kind of make it their own without slamming them. So in this way, I acknowledged what his reflections were and introduced a possible different manner of thinking about the issue that he brought up. So what are the acidic foods to take the patients off? And, this is something that was, that I alluded to up there, but it's animal protein, grains, and foods that are acidy like vinegar, sour like lemons and limes, tart like kiwi, spicy, pungent, hot to the taste without being heated like hot peppers, garlic, onion, etc., nightshades, which only grow in acidic soils, and they grow in soils that are 6.2 or less, okay? Brassica, which are crucifers, cabbage family, mustard, kale, turnips, radishes, etc., and citrus. Then I put them on pumpkin to reinstate the probiotics and prebiotics in the gut. Now, where did I come across the pumpkin? Well, I had some patients that, I was doing a lot of stuff that I was thought was right, and they just weren't clearing up. And they went through the holidays one year, and all of a sudden a half dozen people said, hey, my gut, my bowel movement's cleared up. I said, really? Because I'd had trouble getting them. I got them the best probiotics and prebiotics and etc. Sold it to them. They still weren't clearing up. And I said, well, I don't know. So I started questioning them. And so I started saying, well, what did you eat, say for Thanksgiving and Christmas? And, way back when, we would only have turkey Thanksgiving or Christmas. Well, now you have it year-round. And so these people, it wasn't anything different. And I went through several questions like that. Ham, we used to be every now and again. Now you can have it anytime. And the only thing I could nail down was that they had pumpkin pie. I thought, wow, wonder if that's it. So I started, when people would come in, instead of giving them these expensive prebiotics and probiotics, I started suggesting they go down to Walmart and get pumpkin pie where they have it year-round, and take a half slice, in the morning, half slice in the evening. And lo and behold, they would start clearing up just very quickly. I'm going, wow, got something going here. Well, I started telling people at the seminars I've been, giving. And one of the doctors, a female, did rescue dogs. And they said, well, we give pumpkin to rescue dogs to help clean up their bowels. I didn't know anything about that. I told the patient said, yeah, my daughter gives pumpkin puree to her dogs. And I was, my great niece, she worked in a PetSmart, and I was telling that, and she pointed over at a shelf. She said, yeah, we have puree of pumpkin here. It's for dogs and cats for any type of intestinal ailment. See, I had no idea. I just came to that conclusion by asking patients after they told me what happened after the holidays. So this is very, very easy way to do it. I've done this on hundreds and hundreds and hundreds of patients since then. And they all say, wow, that is so inexpensive and nothing ever helped before. Okay. So let's take a look at the, see if we can bring something up now on the, ketosis. I wonder if that came up on one of those things or... Okay, here we go. And let's see. You know, there it is, right there. Okay, I think I got it now. Okay, can everybody see this? About the Atkins diet? Type yes in that box if you can. Okay, you can see this. Okay, this is one of the things that I teach in my body chemistry class, which I'm starting in Texas, not this weekend, but next weekend. That's TTAPS Part 4. Okay, Atkins diet increases all-cause mortality. And this is in 2010. A major study was just published in the Annals of Internal Medicine from Harvard. So this was major study, major journal. Approximately 85,000 women who were followed 26 years and 45,000 men who were followed for 20 years. Researchers found that all-cause mortality rates were increased in both men and women who were eating a low-carbohydrate Atkins diet based on animal protein. Now that's 130,000 people for from 20 to 26 years. That's a rather long study. So all-cause mortality rates as well as cardiovascular mortality rates were decreased in those eating a plant-based diet, low in animal protein, low in refined carbohydrates. Now notice refined carbohydrates. So basically we're looking for high complex carbohydrate, high fiber type of diets that worked really well. Okay, so now, okay, how many of you actually knew that before? Type over in the box. So I have people ask me all the time about ketosis diets. Okay, I don't know why Alf can't hear me. I'm sorry about that. Okay, thank you, Alf. So how many people knew about the ketosis diet causing an increased all-cause mortality? Let's say a yes or a no in the chat box at the side. Nope. Nope. And that's pretty common for, and we have no pretty much from everybody in here. And I haven't run across people who really know that. Doctors, patients, anybody. People don't know about that study, but I just happen to because I read into the medical literature, you know, pretty heavily all the time. So basically, people ask me about the ketosis diet, and I say, you know, short term, fine. Long term, if you want to die early of all different types of things, then, you know, sorry, you know, go ahead and eat it for a long period of time. And that's what's going to happen. So basically, we look to balance somebody's body chemistry and get them off of ketosis diets pretty quickly if they're on them. Okay? So basically, for this type of condition, you want to get them on a high complex carbohydrate, high fiber, high fresh raw fruits and vegetables diet just as soon as you can. So that being said, that may not be so easy if somebody has not been eating a lot of raw food. And you may have to slowly introduce that raw food, because if you introduce a lot of raw food to somebody who's been having hardly any raw food, they're going to have some horrendous reactions right away. Okay? So you have to do it slowly. For example, you say, well, do you like salads? And they'll say, well, yeah, okay, I want you to start eating a raw salad a day. And so you observe them maybe for a week to see if they have any, really big bad reactions. And then they say, no, okay, we'll eat 2 salads a day, lunch and dinner. So they do that. So you're introducing a little more and a little more. Then you say, okay, do you like any type of fruit? And they'll say, yeah, okay, what kind of fruit do you like? So, and you say, okay, I want you to have one piece of fruit a day in addition to the salads. So they start doing that. And, after a week, then you say, okay, let's go to 2 pieces of fruit today, for a snack in the morning, snack in the afternoon. Then you start telling them, as you're going along with this, to start cooking their food less. Overcooking food causes a lot. So while you're introducing the more raw food, you're also telling them, don't cook your food as thoroughly as you've been doing it. Just back off on it. So instead of a well done steak, for example, go to medium well, then to medium rare, hopefully to rare. Okay? However, right at the start, you tell them to get off the animal protein altogether. You tell them to get off the grains altogether. Okay? And so you're introducing these things one at a time. You're taking the acids out of the diet. You're giving more alkaline diet. You're backing off on how much that they're cooking them. And so now they're getting a lot more live enzymes into their diet. And so as you do this, and normally the normal person, you can get them up relatively quickly to at least 50% raw in the diet. And what you're looking for is to get them to 50 to 70 to 80% raw would be ideal. And back off on cooking the foods too thoroughly. Okay, that somebody's given to Alf. I think Alf already dropped out, Jay. Sorry about that. He probably didn't look at it. So basically you're introducing them gradually into a different lifestyle. You pull them off the acidic foods, right away. You start introducing more and more raw. And always put the people on distilled water. Always. That's a very big thing that I have people do. I've seen more from that particular thing than just about anything. So put them on distilled water. And you're going to start seeing them come out of it. My average patient who is having really, really big Candida problems, fungus problems, we can get totally off the drugs and feeling really, really great in about 2 to 3 weeks. And not even Dr. Crook sees people change that quick. And basically, we're just making the environment unfavorable by making it alkaline, making it raw, getting the acids out of the diet, putting the caprylic acid in to strip the shell off the Candida, putting them on activated charcoal to absorb out of. Okay, I'm going to address the protein sources in just a second here. That's a good question, Dr. Mine, rather. And basically you're putting them on the pumpkin sources. Okay. Now, a good question here, what do you use for protein sources? Well, proteins, amino acids that are normally lacking in the diet of, say, vegans or vegetarians are lysine and tryptophan. Okay? Lysine and tryptophan. Now, the lysine and tryptophan can be easily gotten in raw nuts, raw seeds, or legumes, which are beans, peas, and lentils. And not everybody can have nuts, so you go to the legumes. Not everybody can have legumes, so you can go to the nuts. And just to give you an idea about legumes, people who think that they have trouble with all legumes may not necessarily, or all nuts may not necessarily. For example, I took care of a woman who was a self-made millionaire, went from very poor to very rich in real estate. And she thought that she was allergic to all legumes. And I started questioning her. How about black beans? She says, no, I'm okay with that. And, okay, what about navy beans? No, I'm okay with that. And basically, what we got down to, it was kidney beans. And because she reacted to kidney beans, she thought it meant all legumes. So when somebody poses you with a question like that, start questioning more and more. Okay? For example, some people think that they are allergic to all nuts. And I've had people think that, but it turned out that it was only, for example, pine nuts. It turned out that they could tolerate all other nuts very well, and they had artificially expanded that to all nuts when in essence it was only pine nuts. So when somebody throws something at you like that, just start asking question after question, and a lot of times they'll find out that they aren't having as much trouble as they thought they would. But always have them chew the legumes and the nuts up very fine. So basically, any other type of complex carbohydrate mixed with the beans, peas, or lentils and the raw nuts or seeds will net a complete protein. And I've had people, I had this one gentleman come in and he was told that he needed complete knee replacements in both knees. I told him we need to change his diet around, and he had legs that were bowed like this. I had him stand with his feet together, locked his knee out, and I went between his knees just like this and didn't touch the knees on the other side. And he was 64, and he turned 65 about 3 weeks later. That's how long I treated him. At the end of that, I couldn't slip my hand between his knees. And he grew 3.5 inches. So he went from 6'4" to 6'7.5" by taking the bow out of his knees at age 65. That's pretty cool stuff. And we'll talk about that at some other time. But he said, you know, I've heard a lot of things, but he said, I've eaten animal protein every meal of my life. Breakfast, lunch, and dinner my whole life. I don't think you can get me there. I said, okay. And basically we did, and he couldn't believe it. He says, I don't care whether I have it or not, and I'm feeling great all the time. We got rid of his knee pain. He didn't have to have knees replaced. Okay? And we'll talk about stuff like that in a further class. So, okay, does anybody else have any questions right at this point about anything that we've gone over? So we're going to switch topics just a little bit. Anybody have any questions whatsoever about what we went over just now for the Candida and for fungal type of conditions? Because you can make huge changes in 2 or 3 weeks in somebody with this. Okay, so everybody's understanding that. That's good. So now we're going to go to a different topic, which is best practices. And we are told about best practices all the time, but hardly any of us actually know what best practices are. There we go. I got in front of it. Do you have to stay vegan for life? No, you don't. That's a good question, John. Okay. Once you have the changes made, you want to get them to a point that they eat animal protein no more than once every fifth meal. Okay, so if you have if you eat, say, 3 meals a day, that's about once every 2 days. If you eat 3 meals, 2 snacks a day, that's about once a day. And that's a very, very good question. And, we'll address that and why at a later date when we talk about, say, diabetes. Okay? There's very good literature on that. Basically, combined animal protein and fat together, especially in a cooked form, should be no more than about 20 to 30%, and that's about it. And so, unless you're eating everything raw, and there's a whole bunch of literature behind all of this, and it goes back way into the 1910s, okay? And so we're going to take trips back into the medical literature. Did that answer your question, John? So once you have them where they're at, then you put them back. Okay, so you have to stay vegan for life. Okay, yes, that answered the questions. Okay, that's good. The thing is you're just going to crave it a whole lot less than you did, if at all. Just like this gentleman I was talking about. He never thought we could get there. Okay, evidence-based medicine and best practices. How many of you actually have known what that is before I bring it up today? Because we hear that bandied about in our literature. Toenail fungus and alkaline diet? Yeah, that's right. Richard talks about this. Okay, let's go ahead and talk about that. That's a good subject since we're on fungus. Okay, so if I hadn't moved to Texas, I wouldn't have known about this because I'm a master herbologist as well as having a Master of Sciences degree in biology emphasizing human nutrition. And I tried all sorts of stuff, including tea tree oil and all that sort of thing on toenail fungus, okay? And it didn't work very good. And the medicine doesn't work. Patients were coming to me all the time with this stuff. And you'd have people come in with ringworm, like wrestlers. And I'd try stuff on them, and most of the stuff really didn't work too well. And I'll be the first to admit it. And so I moved down to Texas, and I had half dozen patients over a period of time. They would tell me that every year they had some type of skin fungus, and they would go down and they would bathe in the Gulf of Mexico. They'd take a vacation, go to the Gulf of Mexico, and like Padre Island or something like that, Galveston, and they would bathe in the ocean, swim in the ocean for a week or two. And then they come back and their skin fungus is gone. And I started thinking, whoa, wait a minute. The fungus does not like salt. So I started telling people with the toenail fungus to just take a pan of water, fill it up just enough to cover the toes, take a handful of salt, stir it in the water, soak the nails maybe 5 minutes 2 or 3 times a day. And lo and behold, immediately their nails would start growing out without fungus on it. And then as I learned more, did you all know that, for example, that Listerine, which is, mouth gargle for breath and stuff like that, did you know that that's not what it usually, that's not the original use. It was actually for dandruff. Did anybody know that? Let's see a yes or a no in the box. Listerine was not a mouthwash to start with. It was for dandruff. No. Well, I didn't know it either, but I ran across it in the literature, okay? And so people would be coming into me and they would say, you know, I'm using all these medicated shampoos and nothing takes care of my dandruff. So after reading that, I said, okay, wash your hair, but after you're done washing the hair, get some regular Listerine, dump it on your hair, and just take your fingernails and scrub it in your scalp. Lo and behold, 3 or 4 days, their dandruff was gone, because I also read that dandruff is a fungal condition, okay? How many of you knew that dandruff was a fungal condition? Let's see, hear a yes or a no on that. How many of you knew that dandruff was a fungal condition? No. I didn't either. That's why I'm throwing it out to you here, because I had no idea either, okay? So, and literally 3 or 4 days of doing that, and their dandruff was gone because it was a fungus, and I figured out from Listerine how to do it. And when people came in and they would have these skin funguses, I'd ask them, well, do you have a YWCA, a YMCA? Do you have a neighbor that has a saltwater pool? You know, which are kind of popular, you know, the last 20, 25 years or so. And they would mostly say, yeah. And I said, well, just ask them if you can use their pool for 15 or 20 minutes a day. Don't tell them why, because it'll gross them out. Lo and behold, they start using the saltwater pool, and within a couple of weeks, their skin fungus clears up. Now, skin fungus is kind of tricky because it can mimic any other condition of the skin. So you have somebody with seborrhea, psoriasis, eczema, skin conditions that just aren't clearing up. Most likely that'll tell you right there that it's a fungal condition, okay? So you have them do that and it clears up, and it's just pretty good. And some people say, no, I don't want to use a pool. Can I do the bathtub? So I tell people, yeah, fill up your bathtub with hot water, take a couple of hands of salt, stir it in, soak in it 15, 20 minutes a day every day. And it would clear up. And then some people started asking me, well, what about Epsom salts? Would that do? And I said, I don't know. You know, try it. And it turns out Epsom salts work pretty good too. Same thing. So I have people clearing up their skin funguses, their dandruff, and their toenail fungus and athlete's foot, just doing this with salt. So, okay, how long to clear Candida? Apparently you walked in late. Candida, the symptoms takes maybe 2 or 3 weeks, no matter how bad it is. Can eating no refined sugar defeat it? How prevalent is Candida? Well, I would estimate probably Candida systemically is in maybe 1 out of every 30 to 50 people, okay? Just merely eliminating refined sugar from the diet, will that defeat it? No, but you have to get it out of the diet in addition to everything else that I said to do with the diet, okay? And that's a good question, Zach. Thank you. So after I would have people do the saltwater soak for the athlete's foot or the toenails, fungus in the toenails, I would have them rinse it with Listerine. So I added that. And then I read that Vicks or mentholatum were also antifungal. Now, I want you to kind of get this. When somebody has a thick toenail, you know, like some of these older individuals get, they're really thick and they have to go to a podiatrist to have them cut. That can be either from a toenail fungus or because of a lack of circulation to that toenail, okay? And one of the things about the mentholatum is it creates that heat. So I would have people rub that into where the toenail grows out of, as well as put it on the toenail. And a lot of people, the toenail would just start growing out right because it would the thick toenail would be because of a lack of circulation. Now, if the thick toenail is there because of fungus, it presents a bigger problem because the toenail itself has 5 layers on it. So I would have them go to, if that were the case, to the hardware store, and they would get one of these handheld rotary sanders. It has a little rotary sander on the tip of it. And I would say, okay, you have to sand it down to the lowest layer, get those 4 upper layers off of it, and then proceed with this. Because if the fungus is between the layers, then it's still going to stay there. So in that particular case, it's a Dremel sander. You have to sand it down to that first layer and then do the salt water, the Listerine, and the Vicks or mentholatum. And it will start growing out good. And these older individuals that nobody could, clear them out of it, and they have to every month they got to go to the podiatrist to have it cut. Guess what? Their toenails start working right. Okay, so here is a variety of things that you can do with that. And are they systemic candidiasis? Not necessarily, but you have funguses in these different areas. Okay, and that's how you take care of those. And I would change the diet too, because again, fungus thrives in an acidic environment. So you got to get that acidic environment out of there. Okay. Another thing is when they found out, basically in the early 2000s, that chronic rhinitis was there. They used to think it was bacterial, but then they figured out it was fungus. So they would have the neti pot. And now they have this lavage, the naval lavage. Guess what they put in it? They put saline solution in it. Okay? So you're running that through, and guess what? It flushes out, and the saline takes care of the fungus in the nostrils. Okay? Is there any benefit to having Candida in the body? Well, Candida is normally there. We have small amounts of different pathogens in our body at all the time. That's a good question, Jay. And they should be there in small amounts. That's what they're there for, to eat our garbage. So the idea is when we give them too much garbage to eat, then they overpopulate. Okay? Is that very clear? It's really simple. Yeah, they're beneficial or they wouldn't be there to start with, but we're overfeeding them, so they multiply to a point that we just have too much of them. Okay? Are there any other questions along this line? Any other questions? Okay, when the TOU. I don't know what that means, Zach. Okay, great information. Thank you, John. Zach, can you be a little bit more clear when the TOU? I don't understand that question, Zach. Can you be more specific, please? Okay. I don't know what you mean there, so I can't really answer it. Okay, evidence-based medicine and best practices. We hear about this all the time. Where did I get this? It's on the ACA website. Okay. Resolved, the American Chiropractic Association considers the attached evidence-based medicine and best practices as official policy. Germans say Candida eats mercury. Probably so. I never heard that. That's quite possible. It may get some of the heavy metals out of the system, but still you don't want a lot of it in there. Okay. And that's news to me, Richard, and thanks for the input on that. If you could send me literature on that, I would appreciate it so I can read up on it. American Chiropractic Association supports evidence-based medicine best practices that are predicated by an objective review of the most current valid evidence available in literature and other sources. Information yielded from a thoughtful review of the literature is intended for use designing the most beneficial course of care for an individual patient. The ACA respects provider clinical expertise, recognizes the importance of the individual provider competence in combination with the most current evidence-based practices to fit the needs of the patient. So you may find something that's not in the literature is what this is saying. The unique nature of each patient and a provider's right to choose a quality course of treatment for each individual is also supported. ACA supports the definition of evidence-based medicine as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. Practice of evidence-based medicine means integrating individual clinical expertise. So that's your expertise. You come up with things just like I have that isn't in the literature. Okay? If it isn't in the literature at all. From a systematic research, individual clinical expertise would mean the proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. Increased expertise is reflected in many ways, but especially in more effective and efficient diagnosis and more thoughtful identification, compassionate use of individual patients' predicaments, rights, and preferences in making clinical decisions about their care. By best available external clinical evidence, we mean clinically relevant research, often from the basic sciences of medicine, but especially from patient-centered clinical research into the accuracy and precision of diagnostic tests, including the clinical examination, power of prognostic markers, and the efficacy and safety of therapeutic, rehabilitative, and preventive regimens. External clinical evidence both invalidates and previously accepts diagnostic test treatments and replace them with new ones that are more powerful, more accurate, more efficacious, and safer. In response to medical literature, poor standards, and extreme bias, by the way, that was taken British Medical Journal. That's where it was taken from. So it's not just from chiropractic. They took it out of the British Medical Journal. Creation of practice guidelines shifting to rely solely on randomized clinical trials which have strong clinical evidence. This is problematic because the patient base often includes RCTs, randomized clinical trials, taken from very restricted groups of individuals. When guidelines are based on evidence that is representative of a narrow group of patients, those guidelines are applied unequivocally. A disconnect occurs and patients don't receive the best treatment. Another unfortunate consequence of relying strictly on RCTs, there's a lapse of time between valuable advances in therapies and complete RCTs. So basically what this is saying is that medical doctors find that when they are testing a drug, they take a very narrow approach. Ideally, in the research, they take a person with only that condition and give them that drug to see how they react. Well, medical doctors in practice say, we never see somebody with only that condition, so what are we supposed to do? Because we never see that type of patient. Our patients have 4 or 5 conditions. Okay? So that makes it problematic. Providers should have the most proven up-to-date methods at hand to treat their patients, either by clinical science or by clinical experience or a combination thereof. So that's your clinical experience speaking. Best practices in contrast to restrictive clinical guidelines allow the integration of research and clinical expertise while respecting the unique nature of individual patients and are preferred due to their patient-centered focus as opposed to guidelines that are meant to impose restrictions or limits on providers. While RCTs are without doubt highly valuable clinical evidence, they have limitations and weaknesses when applied across the board. Because of this, it's important to take into review a variety of other clinical evidence information, including case studies, cohort studies, literature reviews, historical performance for applicability and value when developing guidelines and patient care plans. Third-party payers and providers have an obligation to the public to remain aware of new evidence that is released may affect patient care. The ACA is aware of overutilization and questionable utilization of care that occurs in the healthcare delivery system. ACA does not support those who engage in these actions, nor does the ACA support guidelines developed by third-party payers that draw upon out-of-date literature and impede the doctor-patient relationship through excessive management of providers. ACA supports patient-centered healthcare that draws upon a provider's expertise and the available research while effectively and cost-conscientiously treating the patient. Okay? So, if you want a copy of any of this stuff that I'm putting up here, just send me an email for it, drbbrk@hotmail.com, and I will send you any of that. Okay? When patients have the white on the tongue, is that Candida, not full-blown thrush? Well, again, you may have gotten in here late, Zach. Candida is a fungus. It can be Candida, it can be a fungus. Basically, you scrape the tongue off, and you've seen these tongue scrapers that they have in pharmacies. And then you take and you brush the tongue every time, and you change the diet, and maybe use Listerine on it, okay, to flush it out of the tongue there. Patients usually have a huge sugar cravings, absolutely. Very difficult to follow a salad, nuts diet. Any ways to help? Again, okay, you may have gotten in here late, but you got to get them off acid diet. So you have to take them off animal protein, off of grains, off of acidy, tart, sour, hot to the taste foods that are hot to the taste without being heated. What's left? Zach, we went over all that. You probably came in late. We went over all of this stuff, okay? So you may want to get this on a re-record afterwards, which I put in the notes there that I sent when I sent this out. So we can't go over it again because you missed that part, and I'm sorry about that. You have to kind of get here on time to get everything, okay? Now, does anybody have any other questions right at this point before we go on? Anybody have any other questions right at this point before we go on? Okay. Now I'm going to go to films that I have, videos of my techniques, and something that I had not done before. I talked about them, but I really didn't expound on what they were about other than verbally. So I put explanations in. Okay. I'm not really sure why this doesn't go up and over. Okay. Part 1, 2, and 3 are out. Since you probably didn't know about them before, pre-publication price is $250 for a year's viewing. If you order today or in the next couple of days, I'll still give it to you for that. You go to my website at it didn't go too good. Well, I don't know why this is having trouble working right now. Maybe I should go out of it and back into it. Okay. Okay, if you want anything from me, if you want to request the notes, go to drbbrk@hotmail.com. If you want to go to my website, go to ttapscenter.com, as we'll see here in just a moment. Boy, I do not know why that is not going above everything. Okay. After pre-publication, when it's in publication, it's $500 for a year's viewing. Pre-publication is $250. Since you didn't know about it, I'll still let you have it for $250, but you got to order it, by tomorrow sometime. And basically, we want to show you how to get very amazing quick results. That's ttapcenter.com. Go to Seminars Professional. Go to the seminar that you want. 1, 2, 3, or 4. Type in film, and your phone number. Then click down in the down arrow by the $395 and choose the $250 selection. Or you can just call me at 469-995-9907. Okay, you can do any of those. So what are they about? T-TAPS Film 1. Use of myotatic reflexes to resolve pain and biomechanics of chronic neuromuscular skeletal conditions. So this is regarding patient treatment by myotatic withdrawal, crossed extensor reflexes, reflexes of posture and locomotion, and reciprocal inhibition. So normally get somebody off a cane or walker in 1 or 2 visits, or standing up out of a wheelchair in just a couple of visits. If it's due to weakness instead of paralysis, you can get them out of that wheelchair. Immediately restore significant range of motion. Understand how reciprocal innervation can immediately help restore function in distant parts of the body. Correct foot drop in the majority of cases. Cogwheel rigidity of arm and leg of most stroke victims and cerebral palsy victims in seconds. Improve hearing and tinnitus in most cases. If you think you've seen it all, basically you can get rid of fibromyalgia pain in seconds. Sciatica. We talked about the cane or walker. Herniated or bulging discs. Unoperated rotator cuff frozen shoulder syndrome. Regional pain syndrome. Cranial nerve symptoms such as nystagmus, strabismus, Weber's, etc. Hearing loss of differing frequencies. Tinnitus, foot drop. Carpal thoracic outlet syndrome, Phelan's, reverse Phelan's, Tindall's, Addison's, they all come clean. Cold or burning hands or feet, Raynaud's syndrome, loss of vibration sense in the feet or toes, dizziness and vertigo, positive pinwheel test, bladder leakage, burning tongue syndrome or mouth, burning pain in lower extremities or genitals, female cyclic menstrual pain, vaginal prolapse, numb hands and feet, drop transverse cuboid arches, hyperhidrosis, MS symptoms, Parkinson's syndrome, polyhidrosis, cogwheel rigidity from stroke, ALS symptoms, Guillain-Barré seizures, and a lot more. So if you missed part 1, you might want to consider taking part 1 or getting this film so you can watch it over and over and over again. You will be amazed, guarantee. This is not reflexology, AK, contact reflex technique, pain neutralization technique, total body modification, transverse friction massage, spinal reflex therapy, conflict reflex analysis. Something I came up with. It's none of those. It's based on known tenets of acupuncture, trigger point therapy, reflexes, and neurology. That's found in Laws and Tenets in Dorland's Illustrated Medical Dictionary, Chusid's Neurophysiology, Guyton's Textbook of Metaphysiology, and others is taught in all CCE accredited colleges. Treatment effects are verifiable by standard orthopedic and neurologic examination. I'm published in JMPT and Chiropractic Economics on techniques being taught. I'm a former adjunct faculty member, postgraduate division, Texas Chiropractic College. T-TAPS Film Part 2. Now the Part 1 deals with things with very minor scar tissue or just reflexes. And we've been kind of flummoxed by ART, Graston transverse friction massage, that all, every condition has dense scar tissue in the soft tissue. And Part 1 demonstrates nothing is further than the truth. And when you've taken care of those reflexes alone, then you have this dense scar tissue. Okay? So this is scar tissue and rehabilitation seminar. And it's resolving scar tissue deposits to restore range of motion, posture, strength, and walking through reciprocal inhibition. Okay? And we start that off by ending up what we didn't have time to do in part 1. There's so much in part 1. So the first thing we teach here is to test over 200 muscles easily in less than 10 minutes. Immediately strengthen all the weak ones. Extreme atrophy may take longer by lightly touching one spot, just like this on the patient. Immediately, all the muscles come strong, except the ones that have extreme atrophy. That takes a little longer to come along. Second thing we teach you is to palpate the whole body. Takes less than 5 minutes. Immediately decrease and eliminate all pain. Inflamed areas, inflamed areas usually take a bit longer, but that will drop in half the amount of pain that they have, even in the inflamed areas immediately. You lightly teach one area, you palpate all over, the pain is gone except for the inflamed areas, which takes a little longer. Okay? So basically now you don't have to go from muscle to muscle to strengthen it as in implied kinesiology. You immediately strengthen all of them. And you don't have to go from trigger point to trigger point. You immediately get rid of all the trigger points just with one light touch. So this really saves a lot of time and effort and money for the patients and yourself. And it's very easy on you. In most cases, quickly and significantly reduces or eliminates the following symptoms: chronic athletic injuries, hamstring, ankle, wrist, golfers, tennis elbow, rotator cuff, knee issues, turf toe, shin splints, chondromalacia patella, weak ankles, trick knees, etc. Plantar fasciitis, myalgia paresthetica, bronchitis and asthma, gagging, esophageal spasm, reflux esophagitis, TMJ syndrome, migraine headaches, chronic whiplash, chronic hip and knee and ankle, shoulder, elbow, wrist and pain, tendonitis and bursitis, adhesive capsulitis, frozen shoulder, Dupuytren's contracture, trigger finger, Osgood-Schlatters disease, chronic fever and sore throat, scar tissue and acupuncture, old fractures, chronic pain, bone and sclerotome pain, fibromyalgia, burning pain, resistant sciatica. I already talked about the cane and walker. Herniated or bulging disc, rotator cuff, frozen shoulder, foot drop, hearing loss, differing frequencies, tinnitus, all the tunnel syndromes. Small joint fibrosis or ankylosis, chronic shingles pain, arthritic finger and toe joints, unadhere organs from one another, stimulate circulation and lymphatic flow, diaphragmatic and accessory breathing, muscle function, enonasal including balloon nasoplasty and eustachian tube techniques for chronic sinusitis, chronic headaches, true eustachian tube deafness, Meniere's syndrome, female cyclical menstrual pain, vaginal prolapse, dizziness and vertigo, drop longitudinal transverse and cuboid arches, unexplained chest pain, MS, Parkinson's, ALS symptoms, Guillain-Barré symptoms, ankylosing spondylitis symptoms, seizures, and much more. And again, this is not friction massage, transverse friction massage, aka ART, Graston, any of those. So you don't need to get thousands of dollars worth of tools. Usually it takes just one treatment to free up the scar tissue. ART in their seminar says it takes 4 to 6 treatments to clear out one muscle. Graston 6 to 10. Transverse friction massage, right in Syriac's manual, 10 to 20. We'll show you how to do it in one treatment, literally in seconds, with a lot less effort on your part, a lot less pain on the patient's part. What's the rehabilitation part? We show you how to cut your rehabilitation down to about a fourth or a fifth of the time that it's normally been taking you. We show you how to get it done very quickly and efficiently. Again, I'm the only person that's really teaching this stuff. Now, that takes care of the dense scar tissue outside the joints. That leaves dense scar tissue inside the joints. So TTAPS film part 3, adjusting, manipulation, mobilization of extremity, cranial, and vertebra. Now, I've treated 12 professional athletic teams. I was the first chiropractor asked to treat the NFL Run for Daylight and Fastest Man competition because of doing stuff like that. I've treated over 3,000 university, collegiate, high school, middle school athletes, over 800 of which were professional athletes. By the way, 3 of the professional athletic teams were foreign professional teams. Get most athletes back on the field in days, in most cases, even if off of the field for months. And this translates into regular patients as well. We show you how to treat ribs, costal cartilages, golfers, tennis elbow, chondromalacia patella, bunions, flat feet, high arches, drop transverse cuboid arches, reliably relieve reflux esophagitis, esophageal spasm, upper GI conditions, acromion sternoclavicular joints chondritis and costochondritis, hallux rigidus, hammer and claw toes, bowed legs, knock knees, frozen shoulder, adhesive capsulitis, rotator cuff, all the tunnel syndromes, very quickly and efficiently. Cranial techniques. I've gotten rid of autistic children speaking sentences after using only single words. Just to give you an example, one of the docs that I treated contacted me recently, says, "You won't believe this." I said, "Try me." He said, "Had this little child, 5 years old, and never spoken a single word. After treating cranials the way that I showed in class, the child turned head around and said, 'Thank you, doctor.' First words he ever spoke. Doctor was stunned, the parents were stunned. It's something else. So you have kids who haven't talked at all, they speak in squeaks, then they start speaking words. They speak words, and they speak sentences. They speak sentences, then they speak paragraphs. Then they put them in classes with the other children. I'm the only chiropractor that's on the preferred doctor list in the state of Texas, which has the second largest number of chiropractors in the country in it. It's because we can do this stuff. Stop elusive migraines, improve vision, hearing, tinnitus, improve elusive organ and gland dysfunctions, correct TMJ dysfunctions. Okay, stuff that you're really not aware of at all. Now, these first 3 techniques are directed toward correcting the nervous system. The nervous system controls the circulatory and excretory events of the body. So you have maybe several patients that you don't know what's going on with them. You've tried nutritional interventions and it just hasn't been working. Well, you find that when you implement parts of 1, 2, and 3, they clear up by themselves because it was actually a nervous system issue. So you're going to find that you're using a whole lot less nutritional intervention when you properly correct the nervous system, which is the master system of the whole body, of course. Now, part 4 is directed toward pure body chemistry issues. Nutrition, biochemical individuality strategies. Strategic methods to resolve chronic neuromusculoskeletal related diagnoses utilizing diet, nutrient balancing, herbs, supplements, and enzymes. I call it precepts, apodictic, dicta, in nutrition. Precepts are principles governing actions and procedures. Apodictic, clearly established beyond dispute. Dicta, from authoritative sources. So everything that we teach you is in the medical literature, okay? I can't emphasize this enough. It's just not known. By a lot of these things are not known to a lot of people. And I already told you some of the things that I've done. But I've also been a member of 6 medical and scientific boards for major nutrition companies to form formulations. Okay, I performed over 15,000 nutritional assessments, well above that now. It's over 20, maybe 25,000 now. So there are strategies to significantly accelerate correction of people who are allergic to virtually every food. They feel they can't eat anything. I had people that were getting allergy shots every week for 28 and a half years. We got them off the shots. Autoimmune disorders. You'll learn that autoimmunity issues really aren't, and we show you why, and it's in the medical literature. Dysmenorrhea, excess and prolonged flow, get it normal. Bone mineralization, osteopenia, osteoporosis, and fracture. Heal them, get the density back in there very quickly. We show you befores and afters in imaging and on blood tests. Infection, natural antibiotics, nutritional interference of antibiotics, endogenous poisons, metabolic intermediates, hormone imbalances, seizures, fungal and candida infections, chronic fatigue, ulcers, bleeding ulcers, constant bloody noses. We show you how to get rid of those very, very quickly and efficiently. We show you why supplementation for deficiency seldom corrects it by the third and a third rule for all supplements whatsoever. Metabolo-somatic issues and viscerosomatic issues. Nutrient interdependencies, how one nutrient can correct 5 others. We show you just a lot of things on how to get a person back in balance that you're totally unaware of. Deficiency correction through long-term versus catch-up, which is short-term. Lack of ingestion or bioavailability. Obesity, thyroid or non-thyroid, non-caloric, how to correct them, why it occurs. You have somebody, you put them on a diet, they lose weight, then they gain it back plus 10%. Then they go on another diet, they lose the weight, and they gain it back plus 10%. Then they go on another one, they lose the weight, gain it back plus 10%. We show you why that happens. Carbon protein weight loss roulette, the Albicans fallacy. We get into all that. Abnormal cell growth, malnutrition preventing chemotherapy or tumor attenuation. Accelerate good cell growth, decelerate bad cell growth. Nutritional cause and corrections of behavioral disorders, hyper and hypotension, bone demineralization, depression, hyper and hypothyroidism, hyper and hypoglycemia, failure to digest, absorb, metabolize, secrete, and excrete acid-base balances. And this is not what you think. And we get into a lot of things like this. The first thing that I tell everybody about any class that I teach is forget everything you thought you knew about anything, because there's probably a faster, more efficient way to do it. And again, I look at being a shortcut for you in everything that I teach. Okay? Now we're going to go into mentoring. I do mentoring, which we're going to talk about here briefly. And here are just a few testimonials. I'm mentoring right now about a dozen doctors. Dr. B's mentoring program is second to none. This doctor is in California. Basically in the mentoring, we show you any aspect of your practice. How can you help it? How can you help deal with patients more efficiently? How can you stimulate more patients? How do you capture number of patients better? For example, just taking the current number of calls that you take. Out of 10 calls that you take, only 7 or 8 actually set an appointment. Out of those that set an appointment, only 7 or 8 show up. So now you're down from 10 people called to only half of them show up. Out of those, when you give them what you think they need, only about half of those actually will follow through with it. So out of 10 calls, you have maybe 2.5 or 3 actually following through what you give them to do. So we show you how to, out of 10 calls, have 9 or 10 set an appointment. Out of those 9 or 10 show up. Out of those 9 or 10 follow through. So right there you have tripled to quadrupled your practice with getting no new calls. And we show you how to do that. It's very, very easy to do that. But it's something that really is not being taught by practice management consulting or coaching. But we show you how to do it. And here we have Doctor's Bone Breaks Mentorship Program is the best investment I've ever made. And this doctor's from Cleveland, Ohio, and he goes into a lot here. And since mentorship with Dr. Boneberg, I've seen several improvements in my practice. Patients getting their desired results using his treatment methods help me reduce the amount of time I spend with the patient getting better outcomes. Now, this doctor right here, for example, is in a practice with a applied kinesiology diplomate. He was spending 30 minutes on every patient. And it's almost like pulling teeth because I had to get him to think differently because I show him how to get faster results. And so we got him from taking 30 minutes down to 20. Now, guess what? That 50%ed up his patient flow. So instead of seeing 2 patients in an hour, now he was seeing 3 in an hour. So that upped his income 50%. Then we got him down to 15 minutes. That 4-timed his income. Then we got him down to 10 minutes. That 6-timed his income. Then we got him down to 5 minutes. That 12-timed his income. Okay? Then we got him down to 2 or 3 minutes. So you see how that works. Okay? This doctor's in Chicago. He and his wife, he was doing so well. He said, we're going to pick up. I've always wanted to go down to Florida, so they moved to Florida recently. He's banging out of the gates with stuff that we showed him. Now here's another one. I wasn't sure if I needed a mentor. I already thought my business was very successful. I attended Dr. Bonebreak's scar tissue seminar where I witnessed immediate changes on myself, my brother, and observed others with both subjective and objective improvements. This is a doctor down in Houston. And again, what I do is I'm your great shortcut. I show you how to do things in a fraction of the time. I get you how to see a problem, ask a few deft questions, go right to 1, 2, 3, 4, 5, 6 different ways to do it, and get it taken care of. And this is in any aspect of your treatment, any aspect of your practice, not just dealing with treatments, but with any aspect of your practice. And let's see here. Now let's see if we can bring this next one up. Okay, here we go. Okay, here's the mentoring program. Now you might want to consider, if your practice isn't where you've always wanted it to be, you may want to consider doing the mentoring. It fits everybody, okay? I've developed this so that anybody can do it. It doesn't matter how small or large your practice is. I've had doctors come in with multi-million-dollar practices, and within a year, we doubled their profitability. I've taken people doing $40,000 a year, got them up to $400,000 a year very quickly. Okay, so don't think that you can't do it. If you hadn't noticed, just listening to me tonight, I'm very monotone. My wife doesn't understand how I even get through to people because I put people to sleep. Folks, if I can do it, you can certainly do it. I'm nothing special. Okay. How preeminence mentoring works. Enables you to become top level, rapid, efficient patient response with scientific methodology found in medical literature, become a nerve and biochemistry expert, get referrals from everywhere. Folks, I've seen people from all 50 states and 97 countries. There is no reason why you can't do that, okay? Get paid what you're worth, get low stress, better family time. Others committed to change your life. It's your turn. want you to just close your eyes for a minute here. Imagine having the business of your dreams, smooth running, plenty of highly satisfied and enthusiastic patients, as many as you want or can handle, financial security, time to enjoy with your family, time to exercise regularly, and great health. There are 3 reasons for preeminence mentoring works for you. You will devote the effort, time, and dedication to get what you want. You have to commit. You got to do the work. Charisma is not necessary. We have group or one-on-one mentoring, which is very affordable. Your next step is to commit to be superlative. Go to the link, ttapcenter.com, choose the mentoring level that fits you, and commit to change your life. Others have. So what do we have? We have a 12-month group mentoring. So we have a group call, one group call per week for 12 months. It's an hour per week. So you get 52 of those. It's only $250 a month, or one payment of $2,500. Half a patient gets you that, okay, for a whole year. That saves $500. You get that 1 year of one-on-one hourly weekly time, or 1 hour weekly time, and so you get to see other doctors typing in questions, and I answer those questions, and a lot of those questions are ones that you have. You get to type in yours, so I answer all the questions, and we help you to improve your practices. So you get to see what other docs are asking, and you ask your own. And we want to see you up your income dramatically in accordance with your level of commitment. We show you to get paid for what you do. Run your practice in the most efficient manner possible. Think and reason quickly in any practice situation. We show you how to give talks that get a lot of new patients. Folks, I averaged between 35 and 50 patients every time that I gave a talk. Don't ask for patients or referrals and get scads of them. Quit asking. We show you how patients are going to ask you, can you handle any more patients? Okay? Communicate in such a way as to draw referrals to you from all over the place. We show you how to testify in court and depositions. And there's a technique to that. It's not difficult, but you got to know how to do it. How to write narrative reports in the best manner possible. Situations answered that solve your own situations. So you have that. Now you can choose to step up to the 1 year one-on-one mentorship in the first 3 months and get those benefits, which we're going to get to just a minute. The first one-on-one mentoring is you get 26 in a year, so it's one-on-one for 26 weeks, 1 hour a week. That's $1,000 a month, or one payment of $4,000. That saves you $2,000 if you choose to do that. Here we are talking one-on-one with you. Anything that you want to talk about. Now I take a different tack. See, I've taken 32 practice management, practice consulting, practice coaching, and I give you what I think is going to get you there quickest, okay? Everybody has some kind of mentor. I have people that I ask questions of when I have questions on things, okay? I am there to provide a shortcut to you to get you there in the quickest manner possible. How to treat any patient issue. How to communicate. This is at least as impatient as treatment. I give you access to the notes from each of the 4 TTAP seminars. I'll cover what's at the top of your radar first. Now, if you decide to step up to the 1 year mentorship in the first 3 months, you'll get all of its benefits. So look at the one and familiarize yourself with it here. Now, it's the 12 month. You get 1 call a week for 52 weeks. So that's 52 1 hour sessions. It's $1,000 a month, or one payment of $8,000, saves $4,000. This one also includes all 4 films. So you get to watch all 4 of the films that I put out, and I'm almost finished recording the 4th film, by the way, the nutrition course. And then we just have to edit it after that. So you get all 4 films from the time they're fully out for a full year. And you get 12 seminars, 12 live seminars, or I'm going to start getting them to where they have the CEs online too, so you can take them there as well. We're going to create a link to your website for each section. Now, just to give you an idea, I have thousands and thousands of doctor and patient testimonials from each section, TTAPs 1, 2, 3, and 4. When I put those up on my own website, it was good each section for 20 new patients a month. That's 80 in a month, okay? And then each section, your established patients, you direct them to go there, and they're seeing these testimonials of what the doctors found happen on the patients and the patients themselves. And your established patients call up and say, I didn't know you could take care of that. I need you to take care of some other things. So they come back, and that was good for me for 20 patients a month that way. So I got 160 new patient calls every month just off of doing that. Okay. Now, every time I gave a mall show, I got an average of 220 new patients off of each mall show without advertising it. I show you how to do stuff like that. Okay. Now, you'll also be able to get the link to your website for $50 a month for each section. That's minuscule whenever I start doing that, and I'm going to start putting those up soon after I'm done with the films. We're going to have doctors' blogs for just 15 months each for each course. So here you get to interact with other doctors and their successes with the TTAPs, and you'll be seeing what they're doing to fix their patients up, and then y'all may say, well, you know, we can't figure this out. You know, what would you do? And I'll chime in. And you're all going to be throwing in your own practice techniques in there and learning from each other as well. Okay. So you get that one-on-one, 1 hour mentoring for 52 weeks. Any aspect of your practice, how to treat any issue, we show you how to communicate in a very effective way. We give you access to the notes from each of the 4 TTAP seminars. So you come up with a patient that has an issue. I'll say, okay, do you have your notes up? Yeah. I'll say, okay, go to part 1. Then I'll say, okay, go to this set of notes, this page, and I show you what to do in it. Or part 2, part 3, part 4. So you have them there. I show you how to use the notes. I take you right to them so that you can see what to do. Then I describe what to do. You get all 4 videos for 1 year's viewing, up to 12 seminars online or in person. I'll cover what's at the top of your radar first. I give you your year's link to the website, the blogs. Now, basically, if you want to decide you want to go into another year, it's just half the price. So after the first year, just $4,000, because you're going to know a whole lot more, and you're going to be getting real excited. These doctors who've been in just a few months get excited because I show them how to think quicker. And they start getting all these new patient referrals without doing anything other than being more efficient and getting jaw-dropping response every visit. So the second year is just half the price. $1,000 a month for 6 months, or just $4,000. Basically, commit now to achieve your dream practice. Don't wait. The longer you wait, the longer it's going to take. That's all it is. Business results depend on effort and following directions. Lose your excuses and take consistent action to improve. If you'll do this, sign up. If not, don't. You got to do the work, okay? I give you the information and encouragement. You take the action to improve your life. And it's just as simple as that. Okay, now, I'm here for questions. I pretty much said what I need to say. Does anybody have any questions on the films, on mentoring, on the topics that we just had? Any questions whatsoever? We went just about eight minutes over. Anybody have any questions? Now's your time to ask the questions. Any questions whatsoever? I'll give you 30 seconds. How did you enjoy the class? Did you learn something? Did you enjoy it? Just say yes in there, yes or no. Again, if you want a copy of any of these notes, just email me for it. Okay? Yes, you learned something. That's good. That's what these are for. We're going to have these. Okay. Tell Lisa Ansel I said hi. Okay, Jay. Okay, anybody have any other questions or comments? Now's the time to do it. I'm here as long as you want me to be here. That's what these are for. Okay, going once, going twice. Thank you so much. Thank you so much for your comments, and we'll see you next week. Thank you.